Mental Health Awareness is a nonprofit whose goal is to promote the understanding that mental health is a critical part of our overall wellness. Our mission is to improve the quality of life for those living with mental illness and mental health concerns in Michiana. We do this through initiatives that eliminate stigma and break down barriers that prevent access to care. We want to welcome you this afternoon to a trauma-informed response to child and adolescent grief, sponsored by Mental Health Awareness of Michiana in partnership with The Source of Elkhart County. Our presenter today is Lindsy Diener-Locke. Lindsy serves as a program director at Ryan's Place, a nonprofit organization devoted to supporting grieving children, teens, and their families. In her role, Lindsy oversees the development, implementation, and evaluation of grief support programs that provide a safe and compassionate environment for those navigating loss. In 2009, Lindsy received her master's in social work from IUPUI. Lindsy has years of experience working in bereavement and hospice. She is committed to fostering trauma-informed and grief-informed care, tailoring services to meet the unique needs of each family. Lindsy collaborates closely with community partners and volunteers to expand Ryan's Place reach and to ensure access to high-quality support. When she's not working, she enjoys spending time with her family and her pets. Lindsy.
Thank you for that very nice introduction. Hold on just a second as I share my screen. All right, and I think we're all good. So thank you so much for being here with me today. It's an honor to talk with all of you about grieving children and teens and supporting them. We're going to be talking about trauma-informed responses to adolescent grief and child grief. Who are grieving the death of a loved one. However, we know that there's many types of grief, and a lot of this information can translate into other areas as well. So before we dive right in, let's talk about, I wanted to explain a little bit about how we talk about grief at Ryan's Place, because being grief-informed is being trauma-informed. Grief is unique to each person. Often I'm asked, am I grieving the right way? Am I doing this right? Is my child okay? And the answer is yes. Even within a family, everyone is going to grieve differently. Everyone has their own relationship with that person, their own histories, their own unique genetic makeup that makes us, grieve accordingly. So just like a snowflake or a fingerprint, everybody's grief is unique. It's non-linear. There are no defined stages. One of the first things we do in our trainings is ask our facilitators to unlearn the stages of grief. Those who are grieving, they aren't going to feel denial one day and then anger another day and then someday and an acceptance. It's very common to feel so many of those feelings at once, and it doesn't mean that you're regressing. If suddenly you thought you'd work through your anger and now you're angry again, having that prescribed path, we find really adds to the stigma of grief. So grief is cyclical. So what I mean by that is children who experience a death will re-grieve and grieve again in age-appropriate ways when they reach different milestones, which we'll talk about here soon. So even if the death happened 7 years ago, a 14-year-old may be seeking services and it's likely to be grieving in new and complex ways. So at Ryan's Place, the grief doesn't have to be real fresh. It could have been a death from long ago that's resurfacing again. Quote unquote, normal grief is emotional, it's physical, it affects us cognitively and shows up behaviorally. And if you guys don't have the slides, all this information will be given to you. And there is a handout that has all of these developmental stages put together. So most grief charts, bereavement charts, start at age 3 or 4. So, but they've actually done enough research to be able to say confidently that even newborns who are even minutes old have a response to their grief. So even though infants and young children don't have a cognitive understanding, they still react to that separation and the changes in their environment. So increase in crying, irritability, comfort-seeking behaviors. You might see some regression. For example, their reality is just different, right? So for example, a child like little Susie, who was always soothed to sleep by her mom and really relied on that caregiver to provide that for her. After mom is gone, there might be increased irritability and inability to settle down and difficult adjusting because dad just doesn't feel the same and smell the same when he rocks little Susie. Or a 2-year-old who might have more temper tantrums and at the same time be more clingy. We find that these responses highlight the emotional distress that toddlers might experience. You might see regression in behavior. All right, so at Ryan's Place, our youngest group is our littles, the 3 to 5-year-olds. And they still see death as temporary and reversible. So our groups for them really kind of focuses a lot around understanding their emotions, being able to even name them. It's typical for kids at this age to have magical thinking for good reason. They think that the world revolves around them, but then they may also believe that their words hold more power than they do and their actions as well. So really, children, adolescents at any age may feel responsible in some way for the death, that something they said or something they did caused it. But it's especially possible that preschoolers who are just trying to understand, their place in the world and their power. And that can really create some confusion and guilt for children. Children in this age group tend to ask the same questions over and over and over again, developmentally. And it's the same when they're trying to figure out what happened, what is death. So we often will hear, okay, my mom died, but when will she be home? And they also might have, like we said before, behavioral regressions. Suddenly potty training is happening again, or they resume sucking their thumb. When working with families, encouraging caregivers that this is all normal helps them to better understand and respond to their child's grief, and to just encourage them that they are doing a good job and that they're grieving as well. With these younger ones, also grief often goes unnoticed because it looks different than adult grief. I remember a conversation, a mother called and she was setting up an intake, and she said, I'd like to get support for my 10-year-old. He's really, really struggling. Upon more conversation, I discovered that there was also a 5-year-old in the family, and asking but her response was, well, he seems to be doing okay. It doesn't seem to affect him all that much. But once we started talking more, it came up that he's been having a lot more stomach aches and difficulty sleeping. And so when this family came to group, they all noticed changes. And that was one of the changes that he experienced, was not having quite so much anxiety and stomach aches, even at that young age. All right, so school-age children. And we see a lot of school-age children, not only at Ryan's Place, our family night, but we go out into the schools as well. So children at this age are exploring their independence and trying to grasp a permanence of death. They say around between ages 7 and 8, kiddos gain a more concrete understanding that death is irreversible, but they are still concrete thinkers and can definitely tend towards that magical thinking. They might say things like, it's my fault, I was mad, and wish that she would die, and she did. And so, normalizing that, normalizing all of their emotions and all of their fears is something that we can do to be grief-informed and trauma-informed. Regression, acting out in behaviors, changes in academics and sleep patterns, and that doesn't just mean behavioral problems or a slip in grades. Maybe they also are putting all their mental energy into the schoolwork to distract themselves, and suddenly you see a hike in their in their grade point average, although I guess they don't really do that for kiddos. You know, they're more aware of milestones also at this age, that grandma's not at their birthday party, and really processing that. They're often very curious about the death, more details. Was there blood? What happens after the death? So we use a lot of books, activities to help explain that to kids. And their grief ebbs and flows. They might come up to you, ask a question, or share something really profound, and then off they are playing again. And so they are also very protective of their surviving loved ones, which can create a lot of anxiety, going to school, or being separated from their person, especially in a traumatic death situation where, for example, if it was a murder, or such. There was recently a family that came to Ryan's place, and the person who had murdered the father still had not been found. And so understandably, these little girls were very, very concerned about mom's safety and never wanting to leave her side, and even afraid to go outside. So coming to Ryan's place has been really helpful for them. They've received individual and group support. By age 10, 12, children in the later childhood, they develop a much more mature understanding of death and mortality, and can understand that it is final. They have increased awareness that death does occur, and of their own mortality as well. At this age, they tend to be more concerned. They have a growing concern about how others view them. And so being afraid that they are not expressing enough emotion, or expressing too much emotion, or that they're not grieving the right way, tends to come up in this age group. And that goes along with mood swings at this age. They might withdraw from family and friends, try to hide their feelings. Difficulty concentrating is common, changes in academics as well. This is why identifying underlying grief is so important for our youth. You know, being trauma and grief informed looks below the surface to find what's happening underneath, because a lot of these changes may go unnoticed, or be, you know, chucked up to some other kind of diagnosis or reason. Adolescence. It's a critical time when teens are developing their sense of identity. You know, they're capable of understanding the concept of death, how it affects them emotionally, how it affects others emotionally. And they can see it through a broader lens, and they can make the connections, those existential questions, the meaning of life. So in our teen groups, our middle school and high school, there's a lot of discussion. And it's not uncommon that, you know, they're more willing to talk to people outside of their family or their regular peer groups. Often during intakes, parents will say, oh, my teen doesn't talk at all. They're not going to want to be in group. They're not going to talk in group. And then come to find out, that teen opens up a lot in that safe space. And we'll talk about creating that safe space for them. They developmentally are at that stage where they might take more risks. And then when grieving, to cope with that grief, it may lead to drug, alcohol abuse, truancy. Trying to take more risks than usual is something that you might see in a grieving teen. They might also experience increased anxiety, depression, difficulty sleeping, or changes in sleeping. Maybe they just can't get out of bed and are not motivated. They also might have some role confusion within the family. You know, we see this especially with our older teens, that, you know, after, for example, a mom dies, that 17-year-old daughter is doing a lot more caregiving, doing a lot more of the household chores to help her father who's grieving, and her younger siblings. And that's not always bad. It's a coping mechanism as well. Not all teens are forced into that role confusion. It can be their way of coping. So providing trauma-informed care ensures that responses to grieving youth promote healing and avoid re-traumatization. When someone is grieving, we never want to assume that we know their trauma. So going into conversations and assessments, we want to be curious helpers to create an opportunity to meet them where they're at and effectively provide a safe space for healing. I prefer the word trauma assumed over trauma informed, because in the nature where we work and in working with bereavement and grief, and it's such a sensitive topic and it's so hard to come in and find support, we want to just assume that there is trauma as we're approaching until we know otherwise, because what we say and what we do is very, very important. So another one of the handouts you'll receive is a list of common unhelpful responses to grief, and on the flip side, what to do instead. But we will talk about some of these do's and don'ts now. So validate, validate, validate to the child's feelings without judgment, and let them know that everything and anything that they're feeling is okay. Acknowledging their emotions without dismissing or minimizing them creates a foundation for trust and safety, which is really what we strive to do here at Ryan's Place. And I'm sure many of you try to do in your practices as well, is to really, when you're working trauma-informed and with a grief-informed lens, providing them with a safe space where they don't feel judged and they are seen, heard, and understood. So using appropriate concrete language is key. At Ryan's Place, we use the words death and died, never lost or passed away or gone to sleep. That can create a lot of confusion for especially younger children. You know, for instance, there's a story about a child who hears the doctor say, "We lost your father." And later on that week, they ask mom, why aren't we looking for dad? You know, and also there's been cases when I've done intakes where children are having difficulty sleeping, and after asking the parents, you know, what has been described to them, you know, how was the death explained to them? And they say, you know, it's like grandma's in a deep sleep, in a peaceful sleep. And that wasn't malintended. They wanted to, you know, say it in a kind way that they thought their child could understand, and they're wonderful parents. And so we encourage them then to start using those words, death and died. Ask questions about the deceased. You know, there's so many times that our families say that they miss hearing that person's name. They just want them to be remembered. And so anytime to use their name, to ask questions, helps to take away that stigma, that taboo, that grief carries. And be genuine in your communication, empathizing their pain. Another really trauma-informed, grief-informed language shift that is going, the tide is starting to go, you know, larger than the bereavement community, is using the words died by suicide. So we never use the word committed. That goes back to when it was considered a crime. You don't commit a heart attack, you don't commit cancer, and you don't commit suicide. There's enough research to show that when in a healthy right mind, a person would not choose to die by suicide. And that takes away a lot of that trauma and stigma. We have a suicide bereavement group for adults currently. And when we move into our new center, we'll have space for specific ones for teens and children as well. And to be culturally sensitive. As a practitioner or as a community member, to learn more about the different cultural frameworks and how they grieve. So you can provide support that is respectful, effective, and healing. And a lot of these things could be an hour seminar on their own, I realize. So I'm trying to go through quickly. So the don'ts, and these are kind of like the flip side. To don't use those words passed away or lost. To not pass judgment on the timeline of their grief. They are their own grief expert. They know their stories, and their emotions need to be without judgment as well. And to not minimize them, like we talked about. You know, it might seem minor to an adult that their pet died. You know, after all, their father also recently died, but maybe that pet was was a really strong connection to their father. So to not minimize any of these different losses that our families and our kiddos experience. To not assume that all children grieve in the same way, that all responses are normal. And to take into account that society tends to tell children how to grieve if they're a boy or a girl. I remember I was talking with a high school student recently. His best friend had died, and he was like, I just don't know what's wrong with me. Like, I can't get it together. I want to quit school. I'm usually just so strong. And my response was, it sounds like you're really strong to be able to feel your grief. And that I could just see the shift in his shoulders, and his shift in that understanding, even though he didn't feel strong and others might, compare him. To try not to fix it, or tell them what to do, or to move on, or suppress their emotions. Statements like, you need to be strong or don't cry, can unintentionally shame them for their grief reactions. I love that picture. Trauma-informed care is being grief-informed. So how do you know how a child is doing when you do your first assessment? How do you know how they are coping, and how can you best support them? So every agency, private practice, practitioner, everyone works differently and within our own set of limitations. At Ryan's Place, I can tell you what we do at Ryan's Place. Being trauma and grief informed, it begins well before families and children meet us in person. We recognize that it takes incredible courage. It takes incredible courage for grieving individuals to reach out by the phone, first of all, to make that initial intake, but then also to meet somebody that they've never met in a location they've never been, to share about such a difficult and traumatic experience and time in their life. So we strive to break down any barriers possible to our services. So we do our intakes where the groups are going to take place. If it's going to be at our art group, we go to our art group location. If it's going to be on our family night, we meet over at Silverwood, so that that person has already gone through the door, so that on that night when they come and they're nervous to go into group and all the unexpected, at least they have a context of what that space is like, and it's welcoming. We do a lot in our intakes to help to reduce the anxiety associated with visiting a new place by walking through the night, what to expect. So we take date, and also, with creating a safe environment, we take a lot of care in the details of lighting, of comfortable seating, offering choices to make them feel safe, and not just the things that you can give them as well, having fidgets available for kids, that when you're talking to them, they have something else to do with their hands, can make a huge difference in lowering their anxiety level and getting to know you, and helps them to be able to express themselves more fully, and for you to be able to provide more trauma-informed care. In our purpose-built grief center, which I hope you all can come and visit next summer, we look forward to providing an even more intentional healing environment with features that promote, create the not only emotional safety, but physical safety. We're going to have a room where we're going to do our intakes that has a window overlooking a play area. So parents are able to share privately and knowing that their kids are physically safe and taken care of, but having that separation. Sometimes kids come to our intakes, other times not, but I always try to make a specific effort to connect with the kids when they come to group, so that they have a familiar face, creating that trust. So building rapport, building rapport takes time, but it's really, really important. Our intake process is designed to gather a lot of information, a lot of holistic information. We ask about existing support systems. We ask about additional losses or changes. Often families aren't just grieving the death, but maybe they had to move homes, maybe they had to move states or schools. And all these disruptions are dynamics that, we try to take this client-centered and strengths-based approach to meet each family's unique needs. You will get a copy of our intake form, and you'll notice there some of the things that we have on our assessments are we make sure to collect dates, because dates can be really important. Knowing the date the person died, knowing that person's birthday, those milestones are really, really critical, and honoring those makes for a really lovely and healing space for our kids. We emphasize the importance of asking directly about deaths and losses. And this is really important because, like I said, kids grieve cyclically. For example, a school social worker shared with me a case where a second grade girl came to her, was referred to her because she was exhibiting behavioral problems in the classroom that were new. They had just shown up. And, after investigation, she worked with her for a while. It was revealed that her father had died when she was very young. But now at the age of 7, she's seeing the world in a different way. She's at a different developmental stage. And she's noticing that all of her other friends have dads, and where's hers? And so she is grieving in a whole new lens. So digging deeper in our questions and asking more specific questions. For example, when the social worker talked to mom at first, it was like, has she had any recent losses or changes? That didn't really occur to mom that something that happened so many years ago could be affecting her now. So that is something that we can do to be trauma and grief informed. Assessing the impact of grief is really challenging, and it's really important to process it without judgment. Often families, kids, teens that come to us already have faced significant judgment and a lot of unsolicited advice. And they may have been told that their coping strategies are detrimental to their children's healing even. I spoke with a father whose 10-year-old son, after his mother died, would only sleep with him at night because he was afraid to sleep alone. Other family, other friends, all well-meaning, intended, had told this father that he was allowing this regression and it was hindering his son's healing. And we had a big laugh when I reassured him that, co-sleeping will probably not still be a thing at age 18. And that if that helps his son feel safe and loved, that's a very helpful and healing thing that he can offer him. When discussing grief in children and adolescents, we focus on comprehensive assessment of physical, emotional, behavioral, and cognitive symptoms. So on our checklists, there's difficulty concentrating, forgetfulness, changes in behavior. Equally important is identifying their strengths and resources, not only their strengths and resources outside of themselves, but inside of themselves. Being grief informed means reinforcing that expressing emotions is a sign of strength, like I had said with the high school boy. And we really try to affirm and recognize these strengths when our families meet with us, saying like, you're here, you got out of bed this morning and you made it all the way here to meet with me. And that's something. Effective grief support involves offering choices and respecting their readiness. So at Ryan's Place, our approach includes group and individual support. And in planning our interventions, we try our best to help families, teens, kids get into their best fit, whether it's our art group, whether it's a journaling group, whether it's our family night or individual support. As far as our tools and techniques for trauma-informed and grief-informed intervention, we always remember that children grieve and express themselves through play, through their art, and through their stories. So we incorporate those into our group settings and our individual work with grieving adolescents and teens. For the older ones, we do questionnaires as well, but a lot of conversation prompts, right? Involving games with candy, Starburst, Skittles, M&Ms, playing Jenga. Making things interactive with our hands sometimes helps our mouths work a little bit easier. And that's what we find from our children and adolescents. So these activities serve a dual purpose. They create a relaxed and non-threatening environment, and they demonstrate that when our hands are busy, it's easier to open up and express ourselves. So in being trauma-informed and grief-informed, I encourage practitioners, agencies to have that space where children can interact, they can calm down. I know a lot of schools now are having calm down corners, which is so powerful and so trauma informed that maybe that child, they could go to class and be disruptive and sent to the office, or be given a pass that whenever they need, they can go to that place and they can play with the fidgets. They can listen to the calm music. They can, be in dimmer lighting than the harsh, bright lighting that many schools have. So, I think that these tools and techniques that we use are child-centered, and we use, one of my favorite ones is the bag of rock activity, which I've used in kid groups, adult groups, and with individuals. We have a bag of rocks, and each rock has a word, an emotion on it. And so we pass the bag of rocks around, and we all feel how heavy it is. And, there's always a middle school boy that's like, oh, this is so light. It's like, all right, I think it's pretty heavy, but you're good. And we take turns taking a rock out and reading the emotion. Maybe it's anger. And so then I would express a time that I felt angry since my person died, and open it up and have everyone share a time that they felt angry. And I keep that rock out, and the next person goes and takes a rock out. Eventually this bag gets lighter and lighter and lighter. And then the kids can bring their own conclusions that it's like expressing your emotions. It helps to make you feel lighter when you're not carrying that weight alone. I've used this with individuals by saying, after we've done this, which of these rocks are the heaviest for you? They might not look the biggest because the rocks are all different sizes, but pick three that are the heaviest rocks that you carry. And sometimes it really surprises me. I didn't know that guilt was a really heavy emotion they were feeling. And that really does help to direct our work together and our planned interventions. There are specific grief mental health tools out there, and like with a grief response scale, the traumatic grief inventory. I know some of those you will get as handouts. One thing that we do in our work is we will use other mental health screenings, like for depression and anxiety, to help us to better gauge their progress, and also to readjust our work with them, that we are providing the best trauma-informed care possible. So, what are the best practices for organizations to aid grieving families? So take a minute and try to think of things that you can do, or things that you guys already do at your place of work, that ensure that your clients receive trauma and grief-informed care. And what are the best practices at an organizational level? So there are some key strategies that we encourage, and these practices help to create a foundation for support, empathy, and effective services. So, implementing best practices at the organizational level, requires some work. One idea is making sure that all your staff are trained and equipped with the knowledge of grief and trauma-informed care. And, thinking of in the school setting, that's not just the social workers and the teachers, but the custodians and those that work in the cafeteria at, mental health agency. It's not just the clinicians and the psychiatrists, it's the cleaning staff, it's those at the front desk. Having with everybody, because everyone has a connection with the people that are coming into your space. And so, and sometimes those connections we go overlooked. But bus drivers in particular, they see the kids first thing in the morning and last thing when they get off the bus. And so, having them with knowing that they have a grief-informed and trauma-informed lens can really, shape the environment of the school and their experience that the kids have. So creating a safe space. So if you don't already have a safe space in your school or in your agency where kids can just go, that's conducive to expression and healing, maybe there's some art materials that they can use freely, some Play-Doh. Maybe there's an area that they like can go calm down, like I had mentioned before. Thoughtful design elements such as color, comfortable seating, having private spaces for conversation is really helpful in cultivating an atmosphere where they don't feel judged and they feel respected and validated. Collaborating with families plays a vital role in the healing process, particularly when supporting children. So engaging caregivers as partners ensures that the support aligns with their child and their family's dynamics. So organizations can involve families by offering education about grief, whether it's tools, whether it's handouts, whether it's links to different webinars. And to maintain that line of communication with families when you're working with a kid, because there may be more going on behind the surface or behind closed doors that the child is not revealing to you, that would be helpful in your work together. So yeah, offering resources is a key strategy to provide this, a variety of resources. So, peer support groups, counseling, educational materials. So at Ryan's Place, we have a library that families are welcome to come at any time and check out books, because if they're like me and my kids, I like to try to explain things through books sometimes. It's a lot easier and it helps them grasp it in a different way. And so offering them those different types of materials. So evaluating the impact of your program, continuously assessing and improving our programs is important to me at Ryan's Place. We have ongoing evaluations, checking in with families, seeing how they are doing. We have pre-surveys and post-surveys for our school groups. We always welcome the feedback of families afterwards as well. So different things that you can do as an organization to enhance your effectiveness. What you're doing today is something that you're doing personally to enhance your effectiveness in trauma and grief-informed care. At Ryan's Place, in our new center, we hope to have more trainings, more in-depth trainings. One thing that we are very excited about is having our specialty rooms, which community members are welcome to come and utilize. When you're working with traumatized youth, sometimes using a sand tray, going into the hospital room where they can play out their grief, play out their experiences, can be really, really healing and non-threatening. We have a theater room, we're going to have a music room, quiet room, art room, lots of space and resources for the community to utilize, and to really try to create this safe, trauma-informed, grief-informed place in the Michiana area where families can come and find healing, and children and adolescents as well. So I sped through even quicker than I thought I was going to speed through. I don't know if there's already questions in the chat. I can keep on talking, but I don't know if Jan, there are any.
Lindy, there are no questions yet in the chat.
Okay, well, I
Here's what-
guess I was very, very clear in all my things.
I'm sorry, Rebecca just gave us one. When is the expected opening date for your new facility?
We are looking to move in next July. Yes.
Keep putting those questions in the chat, and we'll let Lindsay talk a few more minutes, and we'll come back on.
Yeah, I think that, when families come and kids come, even though it may have not have been a traumatic, quote unquote, traumatic death, like murder, suicide, homicide, children internalize and they process in so many ways that it can come out in trauma. And so I think it's important to really take and look at each child individually, and to not compare, like, that one grief would be more hard to deal with than another one, because really it takes looking at the whole child, their coping skills, their support, and the resources that they have available to them.
Okay, Lindsay. Can the community access the space if the children have not experienced death, but other types of trauma, removal from their parents?
That's a great question. Yes, we plan to collaborate. Please reach out to me. My email is on the last slide. I can go to it. We would love to have our space utilized for all different types of grief. I'm hoping to really work with hospice in collaboration to do some anticipatory grief groups for caregivers who are caring for someone who's dying, for children who have parents dying. We do have anticipatory grief services here at Ryan's Place, but we don't have the capability to provide that at a larger scale. I would love to see groups with children, adolescents who have a parent incarcerated, or working with when they've been removed from their home, with foster children, being able to provide a space, because we know that grief isn't just about the death, and that doesn't mean that and things compound on top of each other, and so they may have experienced a death, and then all these other things happen, and suddenly they are removed from their other caregiver, and they have such a compounded grief reaction. So yes, that's a long answer to, we really do hope to collaborate in many, many, many ways.
Thank you. Lindsay, do you have a list of books that would be good for a resource library?
Yes, I do. There is, The Invisible String. One of my favorite books is also One Wave at a Time. And I can put together a list and send it out. Or if you want to email me, I can send it to you. The Rabbit Listened is another one of my favorites, which can be used not just in grief, but just in general, working with children and adults. It's been read in our adult groups as well. But it's about this little boy and his blocks fall down, and the ostrich tries to get him to put his head in the sand. That will help. The bear tries to get him to be angry. I'm using the wrong animals. And then the rabbit comes and just listens, just sits there, and it provides space. And suddenly they're building up the blocks again. So there are also some teen books that I could recommend. I'm looking over my bookshelf right now, and that's not very helpful because it's so far away. But yeah, I would be happy to get you guys a list of resources.
We can email those out with the resources that we're mailing out next week. Another question, maybe I missed it. Do you have suggestions on things to say to kids that have lost a loved one? We often ask, how are you? But do you have another idea that might be supportive?
Yes, and actually that is one of the handouts that you will receive. Oh, I just pulled it up because I wanted to look at it. How are you isn't bad, but going farther of saying like, I'm really sorry you're going through this right now. I'm here for you. We do get kids that, they get upset when people are always like, I'm so sorry for your loss. And it's like, well, you don't need to be sorry for it. They feel like they have to comfort you, but to shift that to be, I'm sorry you're going through this right now, is more validating, helps to acknowledge. But yeah, there is a do and a don't sheet that you will get a handout. Mirroring their reality. If they are looking upset, saying, you look upset right now. I'm here if you want to listen.
Okay. We have a friend whose 4-year-old has been diagnosed with brain cancer. How can we support he and his wife?
Oh goodness. Well, I'm really sorry to hear about your friend. That's really tragic. I think being able to be somebody that they can talk to and to let them know that. Also, sometimes often families who are grieving don't even know, and this is anticipatory grief, and hopefully this child is able to be healed, and but offering concrete suggestions. So like, I'm making chili tonight, and I'm gonna make a double batch, and I'm gonna bring it over to your house, helping to provide some of those certain needs. Or what, I have nothing to do next Tuesday night. I'm gonna come over and watch your 4-year-old for 45 minutes for an hour and a half, and you guys go out and grab a bite to eat together to help to support their marriage and their relationship. Those concrete things, you know, you can ask friends, ask people, what can I do to help you? And often they don't even know. They don't even know what to do to help. You know, noticing that their grass is getting really long, and your neighbor's grass is getting really long, and they're caring for someone who's ill, to just go ahead and mow their lawn as well. So to do those concrete things can be really, really helpful and meaningful.
Do you know offhand a good account to follow, whether on YouTube, Instagram, TikTok, etc.? I work with teens, and sometimes they're looking for material online.
Mm-hmm. Yeah, we have like concrete books here. As far as I will admit, I am not like the most technologically advanced person. It'll age me a little bit, but I don't really do TikTok. But you know, the Dougie Center I know they have some YouTube videos that you could follow, but that's actually something that would be really good to look into as well. And yes, we do have, I just saw the next question. We do have services in Spanish.
Okay,
Chris
great.
Seminaro is our director of school programs, and she's bilingual. And so on our family night, we have a bilingual, we have a Spanish speaking group for adults. In our younger groups, we have brought in interpreters, translators before. We've helped children who've needed someone to come in and sign for them that they were deaf. And so, yeah, we really work to accommodate everyone. You know, we have also a big Amish population that comes. And so in our littles group, that 3 to 5-year-old group, we have a woman in there that speaks Pennsylvania Dutch, who was a former Amish, a member of the Amish community. And so, and sometimes, you know, things come up, but we always really work to find somebody who would be able to speak that to them in their native language.
Great. I think you might have addressed this, but I'm going to read it again. I am a CASA. The child that I see did not experience death, but was abused and separated from his parents. This involves the same trauma-informed care, doesn't it?
Yeah, I mean, working with them without judgment, meeting them where they're at, providing, you know, and I think that a lot of the books that we use, a lot of the resources that we utilize are for, you can use them in any kind of setting. Uh, Using art, using clay, using any other kind of means can be really helpful in working with that little kiddo as well.
Great. Lindsay, we have a message. So excited to see the expansion of your greatly needed services in our community.
Well, thank you. It's very, very exciting to have us going into a whole new level. And also, we now have on staff a licensed clinical social worker, a part-time child and adolescent therapist, Crystal Caldwell-Weldy, and she is amazing. And so we're able to continue to expand and offer, you know, additional services. We'll continue to refer out as our waiting list, and we'll always see clients for free through our MSW interns, but to be able to offer that is incredible.
Right. Are your services just for the Goshen area?
No, we serve the whole Michiana area. So we have people come from Edwardsburg, from St. Joe County, from Michigan, from the Warsaw community. One way that we've been able to reach the other areas is through our school program. That was my first position when I started 13 years ago, I think, 14, I don't know, was to start the school program. And at first it was really hard to get into these schools and even get, you know, 20 minutes to a half hour. And now we have waiting lists of school groups, 44, and they'll give us a 45-minute chunk because they see that these 10-week groups really, really make a big impact for these kids. And then that's another way that, you know, the schools are being trauma informed and grief informed, to acknowledge that. And we are also called out to crisis calls. So we were recently in a school. I've been to factories. I've been to other nonprofits after the death of a client or the death of a staff. I think knowing and having a plan is one way that you, as an organization, can be trauma and grief informed. We have worked with Elkhart Community Schools to develop their crisis intervention plan, and it has really helped. They still bring us in, but they do things, ahead of time to get things set up. They know, they use this concrete language in their communication with families, their teachers. So, we are happy to come out, provide education, trainings for your staff. I'd love to connect more with, we already connect with Oaklawn and Bowen Center. We've done groups in partnership with Oaklawn occasionally, and we're always working to, all of our goals are the same, to really help these families, these children and these teens in our community that are hurting. So.
Are you able to incorporate faith in your services if that is important to the client?
Yes, at the individual level. So how I explain it to our families when we do the intake is, and we won't soon be located at a church, but I always say, even though we're located in a church, our services are not religious. Now, that doesn't mean that faith doesn't come up in our groups, because faith is really important to a lot of people when they're grieving, and we want to honor and respect that. And it's so important in their healing. For others, they are just angry at God. They've turned away from faith. We want to provide a space where everyone can come together. So our facilitators are trained to not incorporate faith or go from a certain lens, a certain faith lens. However, faith does come up, especially more in the adult groups. And as long as the facilitators are keeping it a calm and safe environment where everyone's feeling heard and accepted, that's okay. It's not like a taboo, like we don't talk about that. But at the same time, we want to make space for everyone where they're at.
Okay, great. I don't see any more questions. If I missed your question, please send it again. I think I have gone through all of the questions that we had.
Well, I just want to thank everybody for coming today and showing up. And if you have more questions, reach out. I hope that you find the handouts that are attached helpful with those do's and don't lists. And then also our intake form. Like I said, when you're assessing a client, it really does help to ask specifically the words, is there a death? Have they ever experienced a death before? Because maybe that child or that teen, the death happened when they were 5 and now they're 15, but they're re-grieving in a whole new way, and that can get really overlooked by adults.
Great. Well, we want to thank Lindsy again for sharing a trauma-informed response to child and adolescent grief. We want to thank the Source and Elkhart for their partnership, and we want to thank Ryan's Place as well for your partnership today. Remember to do your evaluation. If you submit your evaluation by 5 p.m. today, you'll be entered into a drawing for a prize. If you're requesting CEs from this presentation, please complete the post-test, and the certificates will be emailed to everyone. We do want to announce that we have Journey of the Mind art event sponsored by MHAM. It's our first Journey of the Art event. It's on February 22nd, and MHAM is inviting artists of all ages and skills from Michiana to showcase interpretations of mental health at this event. Flyers will be emailed to you with the resources that Lindsy has provided. So we're inviting any budding artists to present your work for our event on February 22nd. We will now end the webinar. And again, we thank you all for participating on today. Have a great, warm Friday.